Hello friend, this is me. Welcome back to our channel. I hope you all are well and doing great. So today I'm back with another video to give review on or talk about something. If you guys wanted to buy the best-selling books, you can buy it from our Amazon page. So today we're going to see another disease. But before starting from it, you can watch it. So as we have discussed acne in the last videos, if you guys haven't watched it yet, you can watch it on our channel. So today we will going to see or talk about something arthritis. But as I already told you that this video is just for information, you always have to consult your physician or doctor before doing anything. We just want to know what this disease is and what symptoms we can have in these diseases. So today we're going to see arthritis. Arthritis is a common disease that causes pain and inflammation in a joint. In the UK, millions of people have arthritis or other similar conditions that affect the joints. Arthritis affects people's Arthritis affects of all ages, including children. Types of arthritis: osteoarthritis and rheumatoid arthritis. Are the two most common types of arthritis. Osteoarthritis is the most common type of arthritis in the UK. It most often develops in people in their mid-40s or older. It also more common in women and people with a family history of the condition. But it can occur at any age as a result of an injury or be associated with other joint related conditions such as gout or rheumatoid arthritis. Osteoarthritis initially affects the smooth cartilage lining of the joint. This makes movement more difficult than usual, leading to pain and stiffness. Once the cartilage lining starts to roughen and thin out, the tendons and ligaments have to work harder. This can cause swelling and the formation of bony spurs called osteophytes. Several loss of cartilage can lead to bone rubbing on bone, altering the shape of the joint and forcing the bones out of the normal position. The most commonly affected joints are those in the hands, spine, knees, hips. If we will see more about osteoarthritis, then it is a condition that causes joints to become painful and stiff. It's the most common type of arthritis in the UK. The main symptoms of osteoarthritis are joint pain and stiffness, and problems moving the joint. Some peoples also have symptoms such as swelling, tenderness, grating or crackling sound when moving the affected joints. The severity of osteoarthritis symptoms can vary greatly from person to person and between different affected joints. For some people, the symptoms can be mild and may come and go. Other people can experience more continuous and severe problems which make it difficult to carry out everyday activities. Almost any joint can be affected by osteoarthritis, but the condition most often causes problems in the knees, hips, and small joints of the hands. You should see your GP if you have persistent symptoms of osteoarthritis so they can confirm the diagnosis and prescribe any necessary treatment. Causes of osteoarthritis is part of normal life. Your joints are exposed to a constant low level of damage. In most cases, your body repairs the damage itself and you do not experience any symptoms. But, but in osteoarthritis, the protective cartilage on the ends of your bones breaks down, causing pain, swelling, and problems moving the joint. Bony growth can develop and the area can become swollen and red. Redness can be harder. Redness can be harder to see on brown and black skin. The exact cause is not known, but several things are thought to increase your risk of developing osteoarthritis, including joint injury, overusing your joint when it has not had enough time to heal after an injury or operation. Other conditions: secondary arthritis. Osteoarthritis can happen in joints severely damaged by a previous or existing conditions such as rheumatoid arthritis or gout. Age: your risk of developing the condition increases as you get older. Family history: osteoarthritis may run in families, although studies have not identified as a single gene responsible. Obesity: being obese puts excess strain on your joints, particularly those that bear most of your weight, such as your knees and hips. Being a woman, osteoarthritis is more common in women than men. Diagnosing osteoarthritis: to help determine whether you have osteoarthritis, a GP will first ask you about your systems, symptoms, and examine your joints. A GP may suspect osteoarthritis if you are aged 45 or older. You have joint pain that gets worse the more you use your joints. The stiffness in your joints is not there in the mornings or lasts less than 30 minutes. If your symptoms are slightly different, this may indicate another joint condition. For example, prolonged joint stiffness in the morning can be a sign of rheumatoid arthritis. Further tests such as x rays or blood tests are not usually necessary but may be used to rule out other possible causes, such as rheumatoid arthritis or a fractured bone. Treating osteoarthritis. Osteoarthritis is a long term condition and cannot be cured, but it doesn't necessarily get any worse over time, and it can sometimes gradually improve. A number of treatments are also available to reduce the symptoms. Mild symptoms can sometimes be managed with simple measures, including regular exercise, losing weight if you are overweight, wearing suitable footwear, using special devices to reduce the strain on your joints during your everyday activities. If your symptoms are more severe, you may need additional treatments such as painkillers, such as painkillers, and a structured exercise plan with a physiotherapist. In a small number of cases where these treatments haven't helped or the damage to the joints is particularly severe, surgery may be done to repair, strengthen, or replace a damaged joint. Living with osteoarthritis. As osteoarthritis is a long term condition, it's important you receive support to help you cope with any issues such as reduced mobility, and advice on any necessary financial support. Some people may find it helpful to talk to their GP or others who are living with osteoarthritis, as there may be questions or worries you want to share. Preventing osteoarthritis. It's not possible to prevent osteoarthritis altogether. However, you may be able to minimize your risk of developing the condition by avoiding injury and living a living a healthy lifestyle, exercise, exercise or a job that puts frequent strain on your joints and forces them to bear an excessive load can increase your risk of osteoarthritis. Try to do at least 1 50 minutes 150 minutes of moderate aerobic activity such as cycling or fast walking every week. Posture. It can also help to maintain good posture at all times and avoid staying in the same position for too long. If you work at a desk, make sure your chair is at the correct height and take regular breaks to move around. Losing weight. Being overweight or obese increases the skin strain on your joints. Losing weight may help lower your chances of developing the condition. So, the second type of arthritis is rheumatoid arthritis. Rheumatoid arthritis is less common than osteoarthritis. It often starts when a person is between 30 and 50 years old. Women are to more likely to be affected than men. In rheumatoid arthritis, the body's immune system targets affected joints, which leads to pain and swelling. The outer covering synovium of the joint is the first place affected. This can then spread across the joint, leading to further swelling and change a change in the joint's shape. This may cause the bone and cartilage to break down. People with rheumatoid arthritis can develop problems with other tissues and organs in their body. If we see more about rheumatoid arthritis, then it is a long term condition that causes pain, swelling, and stiffness in the joints. The condition usually affects the hands, feet, and wrists. There may be periods where symptoms becomes worse, known as flare-ups or flares. A flare can be difficult to predict, but with treatment, it's possible to decrease the numbers of flares and minimize or prevent long term damage to the joints. Some people with rheumatoid arthritis also experience problems in other parts of the body or more general symptoms such as tiredness and weight loss. When to get medical advice? See a GP if you think have symptoms of rheumatoid arthritis. So they can try to identify the underlying cause. Diagnosing rheumatoid arthritis quickly is important because early treatment can prevent it getting worse and reduce the risk of joint damage. Causes of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. This means your immune system, which usually fights infection, attacks these cells that line your joints by mistake, making the joints swollen, stiff, and painful. Over time, this can damage the joints, cartilage, and nearby bone. It's not clear what triggers this problem with the immune system. Although you are at an increased risk if you are a woman, you have a family history of rheumatoid arthritis, or if you smoke. Treating rheumatoid arthritis. There is no cure for rheumatoid arthritis. However, early diagnosis and appropriate treatment enables many people with the condition to have periods of months or even years between flares. This can help them to lead full lives and continue regular employment. The main treatment options include medicines that is taken long term to relieve symptoms and slow the progress of the condition. Supportive treatments such as physiotherapy and occupational therapy to help you keep mobile and manage any problems you have with daily activities. Surgery to correct any joint problems that develop. Depending on how much pain, stiffness, or joint damage you have, daily tasks may become difficult or take you longer to do. You may have to adapt the way you do everyday tasks. Complications of rheumatoid arthritis. Having rheumatoid arthritis can lead to several other conditions that may cause additional symptoms and can sometimes be life threatening. Possible complications include carpal tunnel syndrome, inflammation of other areas of the body, such as the lungs, heart, and eyes, an increased risk of heart attack and stroke, and in making sure that rheumatoid arthritis is well controlled can help to reduce your risk of these complications. Other types of arthritis and related conditions: ankylosing spondylitis, a long term inflammatory condition that mainly affects the bones, muscles, and ligaments of the spine, leading to stiffness and joints fusing together. Other problems can include the swelling of tendons, eyes, and large points, cervical spondylosis, also known as degenerative osteoarthritis. Cervical spondylitis affects the joints and bones in the neck, which can lead to pain and stiffness. Fibromyalgia causes pain in the body's muscles, ligaments, and tendons. Lupus, an autoimmune condition that can affect many different organs and the body's tissues. Gout, a type of arthritis caused by too much uric acid in the body. This can be left in joints, usually affecting the big toe, but can develop in any joint. It causes intense pain, redness, and swelling. Psoriatic arthritis, an inflammatory joint condition that can affect people with psoriasis. Enteropathic arthritis, a form of chronic inflammatory arthritis associated with inflammatory bowel disease, the two main types being ulcerative colitis and Crohn's disease. The most common areas affected by inflammation are the lower limb joints and the spine. Reactive arthritis. This can cause pain and swelling of the joints, sore eyes, and extreme tiredness. It develops shortly after an infection of the gut, bowel, or throat. Secondary arthritis, a type of arthritis that can develop after a joint injury and sometimes occurs many years afterwards. Polymyalgia rheumatica, a condition that almost always affects people over 50 years of age, where the immune system causes muscle pain and stiffness, usually across the shoulders and tops of the legs. It can also cause joint inflammation. Symptoms of arthritis. There are lots of different types of arthritis. The symptoms you experience will vary depending on the type you have. This is why it's important to have an accurate diagnosis if you have. Joint pain, tenderness, and stiffness. Inflammation in and around the joints. Restricted movement of the joints. Warm red skin over the affected joint. Weakness and muscle wasting. Arthritis and children. Arthritis is often associated with older people, but it can also affect children. Most types of childhood arthritis are known as juvenile idiopathic arthritis, known as GIA. Juvenile idiopathic arthritis causes pain and inflammation in one or more joints for at least 6 weeks. Although the exact causes of GIA is unknown, the symptoms often improve as a child gets older, meaning they can lead a normal life. Oligoarticular GIA is the most common type of GIA. It affects up to 4 joints in the body. most commonly in the knees, ankles, and wrists. Oligoarticular chia often goes away without causing without causing long-term joint damage. But there is a risk that children with the condition may develop eye problems, so regular eye tests with an eye care specialist, cold and ophthalmologist are recommended. Polioarthritis is the second most common type of GIA and affects 5 or more joints. It can affect a child of any age and may come on suddenly or develop gradually. The symptoms of particularly GIA are similar to the symptoms of adult rheumatoid arthritis. A child with the condition may also feel unwell and may occasionally have a high temperature of 38 degree or above. Systemic onset GIA. Systemic onset GIA begins with symptoms such as fever, rash, a lack of energy, and enlarged glands. Later on, joints can become swollen and inflamed, like polyarticular GIA. Systematic onset GIA can affect children of any age. Arthritis related arthritis is a type of juvenile arthritis that often affects the joints of the leg and spine, causing inflammation where the tendons attach to the bone. It can cause stiffness in the neck and lower back in the teenage years. It also linked to a painful eye condition called acute uveitis. Treating arthritis. There is no cure for arthritis, but there are many treatments that can help slow it down. Osteoarthritis treatment include lifestyle changes, medicines, and surgery. Treatment for rheumatoid arthritis aims to slow the condition's progress and minimize joint inflammation. This help prevent joint damage. Treatments include medicines, physiotherapy, and surgery. Living with arthritis isn't easy, and simple carrying out simple everyday tasks can often be painful and difficult. However, there are many things that can do to live a healthy lifestyle. A range of services and benefits are also available. Work. Many people with arthritis want to continue working for many reasons, including better financial security and higher self esteem. Improved treatment approaches have helped ensure that many people diagnosed with arthritis can return to work. This is particularly the case if arthritis diagnosed with is diagnosed with and treated at an early stage. You may find work challenging, but your employer should help you with the training and support you are unable to work. Healthy eating. It's very important to eat a healthy, balanced diet if you have arthritis. Eating healthily will give you all the nutrients you need and help you maintain a healthy weight. Your diet should consist of a variety of foods from all five food groups. These are fruit and vegetables, starchy foods such as bread, rice, potatoes, and pasta, meat, fish, eggs, and beans, milk and dairy foods, food containing fat and sugar. If you are overweight, can really help you cope with arthritis. Too much weight places excess pressure on the joints in your hips, knees, ankles, and feet, leading to increased pain and mobility problems. And mobility problems. Exercise. If your arthritis is painful, you may not feel like you can help reduce and prevent pain. Regular exercise can also improve your movement and joint mobility, increase muscle strength, reduce stiffness, boost your energy. Joint care. If you have arthritis, it's important it's important to look after your joints, to look after your joints to avoid further damage. For example, trying to reduce the stress reduce the stress on your joints while carrying the out everyday tasks. Children with arthritis. Make sure your child eats healthily and exercises regularly. They need to maintain a healthy weight because being overweight can put strain on their joints and make their arthritis symptoms worse. Having arthritis shouldn't stop your child leading a normal school life, but keep the school informed about your child's health so they can provide extra support if you need. So, this is all we have from this topic, which is arthritis. I hope you guys get the information, but again, I want to say that if you wanted to use any treatment or anything, you should consult your physician first. So I'll be back with another videos with another books to give review on or to talk about more topics like these. If you like the videos, don't forget to press the like button. Till then, just take care and goodbye.